Hello, my name is Liboro, and I'm currently a community-based researcher from the Center for Addiction and Mental Health, which is based in Toronto, Ontario, Canada. It's a pleasure for me to be able to share my research work with you today, and I thank you for taking the time to be here. There's considerable resilience against HIV/AIDS among middle-aged and older gay, bisexual, and other men who have sex with men. Despite being part of a population at increased risk for acquiring HIV, many men who have sex with men 40 years and older have remained HIV-negative since the start of the epidemic. Among older HIV-positive men who have sex with men, many have exhibited resilience against HIV/AIDS, not only by surviving its adverse impacts, but also living active and full lives and fiercely advocating for their rights and needs. Since the beginning of the HIV/AIDS epidemic, men who have sex with men have remained the population most affected by HIV/AIDS in developed countries, including Canada and the United States. Although the proportion of HIV cases among men who have sex with men 20 to 39 years old has been decreasing since 1994, the proportion of new HIV infections among those 40 years and older have been gradually increasing in recent decades. The Public Health Agency of Canada reports that most research available on HIV/AIDS among men who have sex with men has focused on their vulnerabilities, their struggles and challenges, and that research on their resilience against HIV/AIDS is wanting. The Public Health Agency of Canada also reports that although there are many studies focused on young men who have sex with men, there is a lack of research focused on their older counterparts. This suggests that the resilience of middle-aged and older men who have sex with men against HIV/AIDS represents a serious research gap, and that more strengths-based studies on middle-aged and older men who have sex with men need to be conducted and perhaps even prioritized. The aim of our research project is to examine the resources, the strengths, and the protective factors that HIV-positive and negative 40 years and older men who have sex with men possess that prevent HIV transmission and acquisition in the community and allow them to thrive in a society that may not be ready to meet their growing needs in the near future. Our project represents a strong, collaborative, academic community partnership with a research project team made up of academic researchers, community partners, and middle-aged and older men who have sex with men. From the inception of our project, our partnership has been consistently supported by many community collaborators from the different not-for-profit LGBTQ agencies and groups and aid service organizations from across Central and Southwestern Ontario. From the very beginning, we've also purposefully sought out the support of collaborators who specifically provide healthcare and social support services to racially diverse middle-aged and older men who have sex with men. With the input and support of our community partners and collaborators, we were able to obtain generous funding from the Canadian Institutes of Health Research and a Research Ethics Board approval for our study protocol. We were also able to ensure the meaningful involvement of middle-aged and older HIV-positive and negative men who have sex with men in our research process, not only as study participants, but also as members of our research project team and our community advisory board, and as our peer researchers. As members of our research project team and community advisory board, they have been able to provide their perspectives and input at every stage of our research process. As peer researchers of our project, they were recruited, hired, and trained to take on various research responsibilities and duties. They underwent training so that they could gain increased capacity to fully participate in our entire research process. Our peer researchers were trained on the principles and tenets of community-based research, qualitative co-interviewing of study participants, the DEPICT model for participatory qualitative research, the transcription of interviews, and thematic analysis. To date, we have interviewed over 50 participants with a very diverse range of syndemic and intersectional characteristics and significant lived and work experiences. Once we have reached our data saturation on main themes in our interviews, we will proceed with the analysis of our data. This analytic process is going to be a process that will involve our project team, our community advisory board, and our peer researchers. We will then happily share our project's findings and lessons learned using knowledge mobilization products and platforms, specifically both for the academe and all relevant communities. It's our hope to achieve all our research goals by the end of the year 2020. Thank you very much.